Hi, Dr. Gullberg here on the Internal Medicine series. Today we're going to talk about shingles and the shingles vaccine. Uh, because I've been doing this for almost 30 years, I've seen some horrendous cases of shingles. But most of the time, shingles is a very mild illness. So in order for one to get shingles, you have to have had chickenpox. Chickenpox, of course, is a herpes virus. It's a latent virus. So once you get it, it's alive forever in your dorsal root ganglion. And it comes out as shingles later in life. We see it in the young people, teenagers. We see it as old as 95 years of age. About 30% of adults are going to get shingles. About 70% do not get shingles, and those are in people who've had chickenpox as children. When you're going to get shingles, you're going to get it on a dermatome generally. Zoster means belt in the Greek, so most of the time we see it in the lumbar, the thoracic, cervical, sometimes up on the face, dermatomes. The rash lasts about 3 weeks. Before the rash, generally people have pain from anywhere from 2 to 4 days. Once the rash starts, we need to get going right away on anti-herpes zoster medication. And you can use Valtrex, Famvir, or Cyclovir. They're all effective. But you have to get the medication going within 48 hours to hasten or accelerate the healing time, as well as decrease the severity of the post-herpetic neuralgia that can occur. Does not decrease the frequency of post-herpetic neuralgia, but does decrease the severity of PHN. As you live each decade, your risk for PHN increases. So if you're 50 years old, you got about a 50% chance of getting PHN. If you're 80 years old, it's more like a 75% chance of getting PHN, and it can be brutal. So it can be hard to treat. People can have itching, numbness, and severe pain. And of course, we have to go with medications that we use for neuropathy in those types of settings. Sometimes I will add steroids if there's a lot of inflammation going on initially with the shingles, as well as their anti-viral agent. It's unusual for us to see encephalitis, hepatitis, and motor neuropathy from shingles. We see it, but it's not that common. And of course, ophthalmic shingles is serious, as is Ramsay-Hunt syndrome when the cranial nerve 7 is involved, and we see it in people's ears. For the most part, people get better with shingles without any complications. It does leave awful scarring. So the shingles vaccine is recommended for people over age 50, but it's a live vaccine, so don't give it for people who have cancer or who are on chemotherapy or who are immunosuppressed. It decreases your risk of getting shingles by 50% down to about 16%. And if you do get a case, it'll be a mild case. So hopefully these tips on shingles will aid you as you counsel people about shingles and the vaccine. Thanks, Dr. Gullberg signing off.